Epidemiology of acute kidney injury in critically ill children and young adults. Definition: acute kidney injury is a sudden episode of kidney failure or kidney damage that happens within a few hours or a few days. AKI causes a buildup of waste products in your blood and makes it hard for your kidneys to keep the right balance of fluids in your body. AKI also can affect other organs such as the brain, heart, and lungs. Acute kidney injury is common in patients who are in the hospital, in intensive care units, and especially in older adults.
Acute kidney injury, or AKI, is when the kidney is not functioning at 100%, and that decrease in function usually develops relatively quickly, typically over the course of a few days. Actually, AKI used to be known as acute renal failure, or ARF, but AKI is a broader term that also includes subtle decreases in kidney function. AKI can essentially be split into three types: pre-renal AKI, meaning the cause of the kidney injury is coming before the kidneys; post-renal AKI, meaning after the kidneys; or intrarenal AKI, meaning within the kidneys. Watch the full video on osmosis.org.
Applications in medicine. The incidence in pediatric acute kidney injury is increasing globally, as are the associated morbidities and mortality. A recent standardization of the definition of AKI has allowed for a more accurate assessment of epidemiology of pediatric AKI. Recent advances in leveraging electronic medical health record systems have allowed for real-time risk stratification and prevention of pediatric AKI in the hospital setting. Newly developed and validated clinical scores have improved our ability to predict AKI and provide a rational context for biomarker utilization in hospitalized children. Novel, non-invasive diagnostic and predictive biomarkers have been launched globally to improve our ability to diagnose and predict AKI and its adverse outcomes as well as recovery.
Why are we worried about acute kidney injury? Kidneys ensure that the body fluid levels are regulated and that waste products and toxins are effectively removed from the blood. Acute kidney injury, or AKI, describes a rapid decline in kidney function over a period of days. AKI is usually diagnosed based on a rise in creatinine, a serum marker of kidney function, or a fall in urine output. What causes AKI? The most common cause of AKI is a reduction in the blood supply to the kidney. This can happen for multiple reasons, but it's most frequently seen in patients who are dehydrated or suffering from infections, especially if they are taking medication that can potentially reduce kidney blood flow, such as diuretics, for example frusemide, angiotensin-converting enzyme inhibitors, such as ramipril, or non-steroidal anti-inflammatory drugs such as ibuprofen. Given these risk factors, it is no surprise that acute kidney injury is a common condition in hospitalized patients. Studies suggest that up to 1 in 5 emergency admissions to hospital will have AKI. Why is AKI important? AKI is a serious medical condition with a mortality rate of between 30 and 40% for the more severe cases. In most cases, acute kidney injury is treatable. However, a good outcome hinges on early recognition and timely treatment. What treatments are available? In the majority of cases, the treatment of AKI is relatively simple and involves withholding potentially damaging medication and the administration of intravenous fluids. It is vital that these interventions are administered early to minimize the risk of acute kidney injury progressing to a life-threatening stage. As well as timely intervention, it is imperative that patients with AKI are monitored for signs of deterioration. Fluid balance monitoring in particular is of crucial importance, as the urine output is a good marker of kidney function. What is AKI Pro? AKI Pro is a program to improve recognition and treatment of acute kidney injury. Ward teams will get extra reminders about deteriorating creatinine levels. By using a specifically designed urine output measurement tool called the wheel, we will improve the quality of output monitoring. Patients will be able to help. We have written information, and the Kidney Safe bracelet reminds patients, carers, doctors and nurses to monitor quantity and quality of the urine. We're using nationally collected lab data to analyze trends in the prevalence of renal failure. With your help, we're hoping to give patients better fluid management, safer prescribing, improved urine output monitoring, and earlier repetition of abnormal tests. If you want to get involved or discuss AKI Pro, please get in touch with your local renal champion or email us at christian.subi@wales.nhs.uk.
Pros and cons. Pros. Patients with severe AKI had significantly higher mortality than those without severe AKI. Mortality was higher in patients with low urine output than those with normal output. Renal replacement therapy was required in 1.5% of patients. Its uses conferred an increase of death. Cons. Acute kidney injury is associated with adverse outcomes in critically ill adults. In a prospective multinational study, researchers examined at 28 days in 4,683 critically ill children and young adults admitted to 32 pediatric clinical care units. AKI was considered severe if the serum creatinine level increased to at least twice baseline.
Hello, my name's Suzanne Doricott. I'm one of the critical care outreach team at the West Cumberland Hospital, and today we're representing the outreach team and looking at how you can help prevent acute kidney injury. Acute kidney injury is a sudden damage to the kidneys that causes them not to work properly. And in the UK, up to 100,000 deaths each year in hospital are associated with acute kidney injury. Up to 30% of these could be prevented with the right care and treatment. Today we're looking at trying to encourage people to remain hydrated and to take care of their kidneys. It's estimated that 1 in 5 people admitted to hospital each year as an emergency has an acute kidney injury. Acute kidney injury can range from minor loss of kidney function to complete kidney failure, and it normally happens as a complication of other illnesses. It's not, as the name suggests, caused by a blow to the kidneys. If we encourage people to look after their kidneys at home, then we can reduce the number of acute kidney injuries admitted to hospital, and you will be healthier as a result.
Issue played in Ecuador. The common and early occurrence of acute kidney injury reinforces the need of systematic surveillance for acute kidney injury at the time of admission to the ICU. Early identification of modifiable risk for acute kidney injury or adverse sequelae has the potential to decrease morbidity and mortality. Previously reported rates of acute kidney injury among children and young adults vary widely, from 5% to 82%. This variation probably results from the difference in case mix, illness severity, coexisting conditions, and definitions of acute kidney injury. Conclusion: acute kidney injury is common and is associated with poor outcomes, including increased mortality among critically ill children and young adults.
Acute kidney injury is the most frequent complication in patients with septic shock and is associated with high mortality. Patients with life-threatening complications from acute kidney injury typically undergo renal replacement therapy on an urgent basis. However, in critically ill patients without life-threatening complications, the optimal time for initiating renal replacement therapy remains controversial. In this randomized controlled trial, 488 patients with early-stage septic shock and severe acute kidney injury were assigned to undergo renal replacement therapy either early, within 12 hours after the onset of acute kidney injury, or after a delay of 48 hours. Acute kidney injury was defined by the failure stage of the Rifle classification, which includes oliguria, anuria, or a tripling of the baseline serum creatinine level. The choice of the renal replacement therapy technique was at the discretion of treating clinicians at each of the 29 participating intensive care units in France. The difference in 90-day mortality between groups was not statistically significant, with a rate of 58% in the early strategy group and 54% in the delayed strategy group. In the delayed strategy group, 41 patients required renal replacement therapy before 48 hours. The delayed strategy group also had more metabolic abnormalities in the first 7 days after enrollment. 9 patients in the delayed group developed severe hyperkalemia, as compared with none in the early strategy group. The authors conclude that there was no significant difference in overall mortality at 90 days when comparing early initiation of renal replacement therapy with a 48-hour delay in patients with septic shock and non-life-threatening complications from acute kidney injury. Full trial results are available at nejm.org.